Balchem Animal Nutrition and Health, we strive every day to deliver results you can see in your animal's productivity and your bottom line. From a smooth transition into the milking string for your fresh cows, to a happy welcome home from your furry friend. From a strong start in your poultry flock, to consistent weight gains for your finishing hogs. We expect to earn your business and your trust with our people, our products, and our science. Our people have an intense passion for your animals and your success. You can count on us for honest, candid advice and practical solutions for your toughest challenges. As the global leader in choline production, chelation, and encapsulation technology, we take our obligation to you and to the environment seriously. Our products are backed by the most extensive and thorough research portfolio, while our business is committed to advancing environmental sustainability and animal welfare. In the end, it all comes down to results. Balchem delivers real results you can count on, results that exceed your expectations, and results that bring true value to your bottom line. Leading the charge to meet the nutritional needs of ruminants, monogastrics, and companion animals, Balchem offers a growing portfolio of nutritional products and a dedication to innovation and industry sustainability. Balchem is here to solve today and shape tomorrow.
Hello, everyone, and welcome to the Real Science Lecture Series. My name is Scott Sorrell, Director of Global Marketing for Balchem's Animal Nutrition and Health Division. Today, we welcome Dr. Wendy Pearson of the University of Guelph. Joint care supplements are widely used in both human and animal athletes, yet the scientific evidence supporting many products fall behind their marketing claims. This presentation explores the evidence for interactions between nutritional interventions and cartilage health, inflammation, and long-term joint function. Drawing on research from horses and companion animals, she'll explore how joints respond to mechanical stress and how nutritional compounds may modify those responses. But before we get started, let's go through a few housekeeping items. On the screen is an example of what you should see as your webinar interface. In the upper right-hand corner, you should see some options that look like this. Here you can access the Q&A tab. Please use this to submit questions during the webinar. All the questions will be collected during the session, and we'll address them at the end. A copy of today's slides is available to download from the Handouts tab. If you're having any trouble during today's session, please type it into the Q&A tab, and one of our session organizers will work with you to resolve the issue. As always, a copy of the handouts and the video of today's presentation will be available at balchem.com/realscience, and that'll be available within 48 hours. I'd now like to introduce Dr. Wendy Pearson. Dr. Pearson is a professor in the Department of Animal Biosciences at the University of Guelph, where she specializes in equine physiology, nutrition, and inflammatory biology. Her research focuses on the role of nutrition and nutraceuticals in modulating inflammation, cartilage health, and exercise adaptation in horses, with transitional implications for other species as well. Since joining the faculty at the University of Guelph in 2016, she has secured more than $3 million in external research funding and has published more than 60 peer-reviewed scientific papers with her trainees. Dr. Pearson teaches several undergraduate and graduate courses in equine physiology, anatomy, and health management, and has mentored more than 50 graduate students. Her work integrates applied research, industry collaboration, and hands-on teaching to advance evidence-based approaches to optimizing equine health and performance. Dr. Pearson, welcome to the Real Science Lecture Series. The floor is now yours.
Thanks so much, Scott, and it's a real pleasure to be here. I want to thank everybody at Balchem for the opportunity to talk with you today. And this is a topic that is near and dear to my heart, and so hopefully we'll have a nice discussion here about nutraceuticals and joint health. So full disclosure, as Scott mentioned, my main area of research is primarily in horses. So this is going to be a little bit horse heavy, but I have brought in some research on companion animals where I see that it's relevant and available, which is not always so easy. So yeah, we're going to talk a little bit about that interface between feed and drug. So before we get there, we've got some pretty fundamental questions to ask, i.e., what exactly is a feed, right? So if we look at what the actual definition of feed is, you're going to find something like what you see on this slide, right? So it's a provision of substrates for maintenance of body weight and replenishment of energy reserves and working muscles and other tissues. So basically, you eat so you don't starve to death. That's essentially what this is saying. So then the next point here, promotion of tissue adaptation, growth, and repair. Okay, now we're getting a little bit beyond not starving to death. Now we're saying, okay, now that you're not starving to death, you have to be able to adapt to the environment around you. And by adaptation, we're talking about those various stressors that come in, be it growth, be it lactation, be it exercise, anything like that, or injury. Then this is essentially part of the role of feed, is to allow your tissue to adapt to those different stressors. Obviously, then we also have this idea of promotion of general health and well-being. So it's not enough to just not be dead, right? The next step is, okay, now that we're not dead, how about we feel good? So there's another aspect of what feed is. And then the last point here is the application of competition strategies appropriate to the athletic task. So now we're kind of veering more specifically into athletes and saying, okay, now that you're not dead and you feel good and your tissue can adapt, let's make you the best that you can possibly be. So I think all of these various things, we can all probably agree that that's a fairly important role of feed in terms of overall health and well-being of our animals. But the next question is, well, is feed perhaps anything else? So take a look at this slide here. So we've got a bunch of different pictures here. So here is this poor fella right here. I think we can all agree that he's not feeling so hot. And I think we can also agree that if something doesn't happen to intervene with this poor guy, he's probably perhaps not even going to live. So if you give hay to this horse who is clearly unwell, does that make hay a drug? Interesting question. But let's move on. So how about this poor fella here? Now he's got something that maybe us people in our 50s can probably relate to, maybe not this bad, but he's got something that I think we can all agree is some sort of a health problem. Now, we know that there are nutritional interventions that we can have or give to this animal that will make him feel better and maybe even make him actually slow down the progression of that disease. Does that make those feed supplements a drug? Maybe. So here's another guy. You can see he's probably not having the best day of his life, the jockey and the horse, and maybe this poor fella down here too. So can we do something nutritionally to modify this anxiety type behavior? And I think we can probably think of a few things nutritionally that we could give any of the three poor individuals in that picture to ease the anxiety. So does that make feed an anti-anxiety drug? And here's a few more examples, like this fella here. He's had way too many groceries in his life. And so this probably suggests that feed, in this case, is even perhaps a toxin, right? And here's another guy here. You can see this guy's got some weird fat patches. This is probably a guy with some sort of advanced insulin resistance. Can we modify that with changing his diet? You betcha we can. I'm not saying we can cure it, but we can certainly manage some of the issues that's associated with that. And this poor fella here has got some kind of arthritis problems going on. And this little guy here probably has some dermatitis going on. All of these things, we know that we can change nutritional approaches and have differences or alterations in clinical outcomes. So this slide is really just to make the point that we have this gray zone somewhere between feed and drug, and this is where our nutraceutical products live. Okay, and there are some positives and benefits to this, in that in some ways we're kind of wandering around in drug world without actually having a lot of the requirements and the very regimented requirements in terms of evaluating these products, and that comes with a number of issues that we're going to talk about in a little bit. Okay, so what we're really talking about specifically today is joint care supplements. So what do we mean by this? So initially, we're talking about something that is dietary. Okay, we're not talking about any of these things that are injectables and this kind of stuff, though they do exist. For the purposes of our conversation today, we're just talking about dietary products, things that are fed. And these are products from natural sources. Now, I'm going to use quotations here for natural sources because that can capture a whole bunch of different things. But theoretically, this is the natural sources that are going to be arising from these nutraceutical products. So the products also have the role of preserving structure or function of cartilage health. Note that they are not, nor should they be, marketed to treat any kind of disease. So this is really just to define kind of what we're talking about. So I have another question here. Can treatments, and again, I'm going to use that word in quotations, can they come from natural sources? And so you can see this little fella here is browsing on a plant that some of you may actually recognize as white willow. And I wish you were all sitting here in front of me, because I would ask you right now, what is white willow from the context of treatments? And somebody way in the back of the room is going to put up their hand and they're going to say, isn't that the source of aspirin? Yep, it is. So this makes it super clear that this indeed can be a source. Natural compounds can be a source of drugs. And we don't have to look even very far to come up with, and this is a very abbreviated list. These are just some drugs that I could come up with that come directly from plants. Okay, so there's a few on here you'll probably recognize. Reserpine is a 30-day tranquilizer for horses. Codeine and morphine, these are drugs I think we're all very familiar with. There's a few others on here that are the cocaine, there's a fun one. So there's a few drugs on here, many drugs on here that are actually coming directly from plants. So this flies in the whole face of this idea that plants are this benign kind of, well, first of all, safe, but also non-effective sources of drugs. This really flies in the face of this. And so it makes the point that we can have some pretty substantial bioactivity from natural compounds. The flip side of that is there are a number of health and performance issues that we know we can modify outcomes with altering nutrition. So, for example, osteoarthritis and joint disease, which we're going to focus on a little bit today. But there are others, of course: Cushing's disease, diabetes, heart disease, dermatitis. This list, again, is certainly not comprehensive, but it really just makes the point that there are problems from a health perspective that we know that we can modify clinical outcomes just by changing nutrition. So we've kind of set the stage here for, if you can kind of think, maybe a perfect storm, right? We've got conditions that we don't have drug cures for example, arthritis. So there's an opening here for some sort of a potential intervention that at least could slow down the disease. So no cure. We also know that there are many adverse events associated with long-term use of conventional drug treatments or drug management strategies for arthritis. So this also opens up another opportunity for compounds or nutraceutical products to be taken up. So what this is really kind of driving is the idea that in companion animals, and in companion animals, I'm talking about horses as well, because we do consider and live with horses just as companion animals. We know that osteoarthritis is the most common joint disease in companion animals, including dogs and cats. So there's a few stats here. So you got about 1 in 4 dogs overall that's affected by osteoarthritis, but you go into geriatric dogs, now we're looking at more than 80% are affected by osteoarthritis. And even when you start looking at cats are a little bit tricky because they're terribly stoic. So a lot of times we don't recognize the condition in cats until it's quite advanced. But if we look at some radiographic evidence in cats over 12 years old, anywhere from 60 to 90% of cats are dealing with this type of joint problem. And even in horses, osteoarthritis, you're looking at around 60% of performance limiting conditions in horses are associated with osteoarthritis. So this is a big deal, is really what these statistics are telling us. And because it's a big deal, and because we don't have a really good cure for osteoarthritis, this is a ripe breeding ground for joint care supplements to come in. So if you look at some of the largest nutraceutical categories, certainly in horses, 40 to 50% of all supplements used in the US are for the purposes of dealing with osteoarthritis. So 60 to 70% of performance horses in North America are receiving some sort of joint care nutraceutical product. I mean, wrap your head around that for a second. 70%, 7 out of 10. So one of the things that I want you to start thinking about as I tell you these statistics is, on what basis are they choosing these products? Right? So clearly they think that there's some sort of a benefit, but what are the criteria that they're using to select which products they're actually going to buy? And the horse piece is part of a much bigger conversation, right? If you look at the global pet supplement market, around $3 billion a year US dollars, and joint health is the single largest sector. So this is a ripe area for companies to come in and have products and have market share. And you don't even have to have a lot of market share to have a major income stream. So, you know, if you look at some of the mindset, if you like, of people who are actively involved in performance horses, this is a study that came out it's getting a bit dated now, it's around 2016, but it's still totally relevant. And what you're looking at here, there's two graphs. So the one here on the left, you can see there's some blue bars here. This is a think tank of advanced performance horse competitors. So the blue bars are the dressage riders, and the red bars are the eventing riders. Now, keep in mind that we're not the same number of people here, and you can see this is number of riders and owners. So we're not really comparing necessarily the numbers of the eventers and dressage riders, but what we want to know is what their perceptions are with respect to, do you feel that the supplements you use to target a specific problem make a difference to your horse? So you can see in both the eventers and the dressage riders, yep, they said, yep, we can see a difference. And in fact, there's like a few here that said, oh boy, we could not live without it. That part's great. But if you look to the left here, you can see here we got slight improvements. These guys don't really know. These guys over here, well, no, we don't see any difference at all. The reason I care about these people over here on the left is they're still buying product. So think about that for a second. Sure, half of them say, yep, difference, can't live without it. But about the same number say, yeah, no, I don't really see a benefit, but I'm still going to buy it. Really? All right, so now let's look over on the right here. And this is the same group. And this is the percentage of riders or owners. And the question here was, what are the reasons for feeding nutritional supplements to your top competition horse? And for both the eventers and the dressage riders, joints and mobility was number one reason. And that reason wasn't necessarily driven by science. It was really driven by marketing. And we're going to talk a little bit more of that in the next little bit. This is things from a doggy and cat perspective. And this is a study here that was published in 2022. And it was looking at kind of a bunch of different studies, all looking at nutraceutical products used in dogs and cats. And what they're looking at here is this, on the left, you've got the black section here in each circle is saying that they saw an effect, right? There was some sort of an effect that was observed. The gray means there was some improvement, but the darker gray here say no effect. So that's the darker gray. So of these categories, this is omega-3 supplemented diets. And this is an omega-3 supplement or nutraceutical. And you can see there's some effect here and you can see some improvement. This is collagen nutraceuticals over here. But look at this guy. This is chondroitin glucosamine nutraceuticals. 89% dark gray means no effect. And yet it's the single largest category of supplements sold for dogs and cats. And if you look over here from the same study on the right side here, what you're looking at is average efficiency score. And this is a kind of a standardized score here. All of the different groups that we see over here are in the plus side, except for category 4. So basically what this means is category 4, these glucosamine-chondroitin supplements, do not have a strong basis of evidence in the scientific literature, but people are buying them. So here's your question. Okay, so we know they want the product. We know at least so far the science doesn't really sell the product. So what does? And I think this slide, and again, forgive me, it's a little bit horse heavy, but it makes the point, I think, equally for different species of companion animals, is that the companies that are manufacturing these products are really drawing on our real desire to have some evidence behind it. Look at the names of these companies and the kind of visuals that they're using, right? So everything here looks super sciencey and super, kind of science geek in terms of either the name or the visual. And this is to a large extent what is driving sales in this area, which, is not necessarily bad, but there are some problems with it. Now, this was a study that actually came out of the University of Guelph some years ago now. This was Stacey Oakey's master's work. And what she did is she went around to a bunch of different tack shops and she purchased joint care supplements from the shelf, just paid price for it. Off she went. And she took it back to the lab and she evaluated how much glucosamine was actually in the product compared with the label claim. So what you're looking at here on the far left, this is the product, and she's very tastefully removed the name of the product. And here's the label claim, okay, in this column. Next column is the measured amount of glucosamine that she found in the lab. And this is the percent found versus the percent that was on the label. So a few things to keep in mind here. First of all, you got about a third of them that were pretty okay, right? You're somewhere between 92 to 110% of what's in the product is actually on the label. Cool, that's probably within a margin of error. But what about these guys? What about product W, right? There was actually 0 in there, which begs the question, what the heck was in there, right? Some kind of white powder. Who knows what it is? But then on the other end of the spectrum, you've got these guys. So this product A was at 220% of what was actually on the label, which means two things to me. One, giant waste of money, because you're basically feeding double what what the label says you should be feeding. And secondly, what if you're having, you're giving this product to an animal that is vulnerable to some sort of toxic event? And we're going to talk about toxic events in a little bit, but then you are unwittingly overdosing this animal, potentially exposing it to some sort of harm. So this illustrates the point that to have a pretty label and to have a science-based marketing type approach isn't enough to guarantee that you're going to have a good product. Okay. So this is a glaring example. And I'm going to use names and call people out because this kind of stuff is really what makes this industry problematic. Here's a product. You can see it's got some, some nice check marks here, stimulates red blood cell production. And at this point, you're like, okay, Wendy, that seems fine. What's the problem with this? Well, here's a screenshot that I took of the website. Now, to be fair, full disclosure, the website is now down. But this is what the website said, the clinical study. And it talks about results. And the bottom line, it works. And look at this. We've got some nice graphs down here that show. Now, if you read the fine print, which let's be honest, who's going to do that? Well, maybe some people like me, but some people don't. So horses fed an active ingredient in this particular product showed significant increases in red blood cells. Okay, so what this is actually showing is that echinacea, which is one of a billion ingredients in this product, increased red blood cell count in horses. Now, the reason why this bothers me so much is because A, the product that was tested in that research was not the product that this company is promoting. And two, these were my research data that were published completely independently of this company. And if you look at the ingredients that are in this product, there's everything but the kitchen sink in here, including lycopene, which, by the way, reduces mean cell volume in rats. So, they're picking on the fact that echinacea increases red blood cell count. So, hey, look at this, we've got a great product. But they also contain lycopene, which actually reduces red blood cell count. So this is a glaring example, and I'm going to be forthright. This is not, this isn't typical of what you see in the industry, but it's out there. And it's an example of how companies are drawing on this kind of hunger for science-based products and exploiting them, right? And anyway, this is a glaring example of what not to do. This is what should happen when things work the way they should work, right? So this is where we have an integration of science and marketing, where the science essentially, you've got research, you've got data, validation, trust. So this is building trust, which of course the marketing people are counting on that. It does build trust, informs decisions. And then as it moves through that development pipeline, then your marketing people are going to create value and ultimately drive better future, i.e. better clinical outcomes in these animals. This is a picture of how it should work. But the reality is that perception does not, and I'm going to say in brackets, always equal reality. Sometimes it does. But in this particular industry, we have a real disconnect between that perception of science-based and the reality of where that science is actually coming from. So a lot of the science-based type products, and by a lot, I would say most. In fact, I could probably count on one hand the number of companies that actually do research on their actual products. So what are the other companies doing? Well, they're doing this indirect research, which is in some ways, in a kind of a glaring example, what I just showed you about EPO equine, i.e. they take research that's done on either different, maybe some feed ingredients, but typically not in the target species. And they're building a story from that, right? They're taking this idea and they're saying, okay, we've got this evidence over here. It has nothing to do with my actual product. But if I put all that evidence together, look at this nice story I can tell you. So you might say, well, okay, well, what's wrong with that, Wendy? Well, here's the problem with that. We know that a lot of these ingredients will actually interact with each other. So what happens when you take echinacea and lycopene and you put it together? Maybe nothing. Maybe something. Maybe it negates the effect. Maybe it augments the effect. We have no idea, right? So, and the other problem that we have is we often, and by often I mean most of the time, if we're talking about equine, canine, and feline nutraceuticals, we don't have species-specific responses to these different ingredients. So, because most of the research that we can get our hands on actually isn't species-specific. So you have a species problem, you've got an interactions problem, and you've got a dose problem. Because the vast majority of doses that you're going to see on these labels are the manufacturer's best guess, most of the time. So, that introduces a lot of problems, right? Well, what about overdosing? What about underdosing? What about standardization? We've got all of these problems. This is an industry that relies on science, but it doesn't have it. And this creates a situation where you are going out there and you're buying these products and you're using the animals that you love as guinea pigs. Okay, so you're literally kind of being a test agent for these products that are out there. So I've painted a gloomy picture. It's really not all bad, but what it is it's an opportunity for, you people are all sitting here and you're listening to this because you have an interest in this. You're invested in it. So here's the model that I'm going to propose. We all, not just as manufacturers, but also as consumers, we need to really take on board and say, what can we do to really contribute to this new vision? So this new vision is data-driven. Just like we expect from our nutrition companies, just like we expect from our drug companies, we must expect this from our nutraceutical companies. Okay, so this needs to be data-driven. This is objective research which creates evidence, discrete objective evidence. And that evidence ultimately gets put together from different sources to create new information where these data have been analyzed, and we start to see relationships and connections emerge. From that information, ultimately, this is where we can hand it now over to the marketing people, where now they take the information and they contextualize it, right? When is it right for my horse? When is it right for my dog? Under what circumstances? At what dose? At what concentration? So all of these various things can be assimilated, and then the marketing people can turn it ultimately into knowledge that evolves into a new collective wisdom. And at the end of the day, with this model, we can really revolutionize the slight chaos that we see in the nutraceutical space right now. Now, all this stuff I've told you so far has probably got you scratching your head thinking, why did I ever consider buying these things? Well, the news isn't all bad. So what I'm going to do now is I'm going to walk you through some research that we've done in our lab. I've also cherry picked a few little projects here and there to show you evidence for efficacy, evidence for safety. Keep in mind, this is not intended to be an exhaustive list of all the studies that are out there. It is literally a cherry pick, but it's just to kind of give you a bit of a sense for what is known. So I'm going to talk a little bit about MSM. We're going to talk a little bit about glucosamine-based nutraceuticals. Remember that one that was supposedly completely ineffective in dogs? We're going to talk about that. I'm also going to talk a little bit about spirulina and some medicinal plant research, because that's some research that's kind of fresh coming out of our lab. And so I wanted to share that with you. So I'm going to start by getting into MSM a little bit. I will apologize. When I went through this slide, some of these graphs look a little bit fuzzy, but bear with me. I'm going to walk you through it. It's going to be great. So this is a study that was published back in 2008. It's one of the very few studies, maybe even the only one, that I've been able to find that really looks at the effect of MSM in horses. So in this particular study, there were 24 horses. Basically, what they did is they tested all of the horses at rest for indicators of oxidative stress. Okay, they were looking at glutathione reductase, glutathione peroxidase, and glutathione transferase. These are all enzymes that are associated with really promoting a kind of an antioxidant state in the body. So let's start off with this one here. So this is glutathione reductase. And what you're looking at, and all of these graphs are going to be the same, is along the bottom here, you've got the days after starting competitions. Okay, so this is for a 6-week period. And on the y-axis here we have glutathione reductase. The black bars, these are the control horses, did not get any supplement. The light gray ones, these are the horses that got just the MSM. And then the dark gray is MSM plus vitamin C. So you can see on day 0, they're all kind of the same. And then they went off to do their jumping competitions. And so after week 1, you can see the control horses now have a little bit lower glutathione reductase. And that trend continues, and the separation between groups gets inflated as we go further down this 6-week period. So by the time we get to 6 weeks here, we have a pretty low glutathione reductase activity here in the control horses. The MSM horses statistically are not different, but once you add vitamin C, now it becomes significant. Now, I want to tell you a little bit thing about vitamin C and MSM. So one of the reasons why vitamin C is often added to MSM products is because it significantly improves MSM absorption. So this is probably one of the reasons why we see a pretty significant difference between just feeding MSM and MSM plus the vitamin C. So here, I think we can all agree there's a pretty clear improvement, and by that's not the word I wanted to use, a pretty clear increase in glutathione reductase activity. My question is, so what? Right? So we make this assumption that to have reactive oxygen species present in blood following exercise is a bad thing. Is it really a bad thing? many of the reasons why we're able to adapt to exercises because of reactive oxygen species. Nevertheless, I won't go down that road. Here's the next one. So this is, again, the pattern is exactly the same. This is glutathione peroxidase. And with this last one here, this is glutathione transferase. So I think pretty similar effects here. And the overall conclusion is that you probably have an impact on these glutathione enzymes, mainly because MSM is a sulfur donor, right? So it is able to donate a sulfur molecule for the formation of glutathione enzymes. So this is probably the way this is working. And if you really buy into the idea that oxidative stress is a negative thing during exercise or following exercise, then you might conclude that MSM could be beneficial in these horses. All right, so we're going to switch gears to this glucosamine-based nutraceuticals, and these are where the fuzzy graphs are. So sorry about that, but just bear with me. So this is a study that looked at the effect of oral treatment with chondroitin and glucosamine in an experimental model of osteoarthritis in horses. So there's two things essentially that I want to, well, maybe three, points that I need to make here. Number one, this table here is looking at joint angles. And this, so again, so it's super fuzzy, so sorry about that. GC is the controls, GT is the treatments, and then you've got joint angles, lameness locator. So this is an objective measurement of lameness. And then you have an AAEP lameness score, which is a subjective measure of lameness. And then all of these numbers, which we don't care about, these numbers here are the effective time. So over this period of, and I forget how long it is, but these T0 through T4, basically we have an improvement over time in most of these horses and in most of these metrics, but there was no difference between the treatment groups. That's what these numbers here mean. So basically, no effect. Now this one, again, super fuzzy, super sorry. This is the lameness locator. Again, this is the objective measure of lameness. And over on the right is we have the AAP, which is the subjective measure of lameness. The red bars here are the controls, and the green bars are the treatments. And when you run some statistics on this, you're going to find that there was actually no statistical difference between these groups. So no effect on joint angles and such. And this is really visually looking at the effect on lameness, which really didn't have an effect. And this is the last one. What you're looking at here, these are outcomes in terms of biomarkers of inflammation in joint fluids. So this is hyaluronic acid, this is chondroitin sulfate, this is PG2, and this is TX. This one is a marker of collagen formation. Same deal. You've got an effective time in all of the groups, but no significant effective treatment. So this is another example of a study that's really, we don't walk away from there having any aha moments about the usefulness of glucosamine. Herbs, there's a lot of stuff we can pull from here. This was a study where which was looking at herbal blend for the treatment of canine osteoarthritis pain. And this is the pain scores that we're looking at here. So this is a veterinary pain score on the y-axis over a period of weeks. And the round dots here, this is the herbal supplement. And the square ones here are the placebo. And again, when you run statistics on this, no significant difference. So this particular product had, again, tons of herbs in it. Had bromelain, boswellia, devil's claw, turmeric, I forget a bunch of other stuff, dandelion root. So certainly the formulation that was given in this study did not seem to have any significant effect. Now, here's one of my oldies but goodies. This was a study that I did back when I was a postdoc about 1,000 years ago. And this was really a cool study because it was kind of a collaboration between the Department of Plant Agriculture, where they bred a type of mint that overexpressed rosmarinic acid, and then the department that I was working in clinical studies. And so this was a pretty interesting study. So what you're looking at here, this is synovial fluid. Here, let's do this. synovial fluid, prostaglandin E2, which is that chemical that you're actually trying to reduce when you give bute to a horse, for example, or some sort of NSAID or non-steroidal anti-inflammatory to a dog. This is often the compound that you're trying to reduce, which is involved in pain signaling. So then along the x-axis here, we've got time. So this is post-injection day. Okay, so we started feeding our groups. The open circles here are the control horses, and the closed circles are the horses that got the rosmarinic acid enhanced mint. And you can see we fed them for 21 days, and then we did a low dose LPS injection into one of their joints, which was very low dose, so the horses really didn't go lame. And you can see that the control horses, after that injection, had a pretty significant spike in PG2 that we did not see in the horses that had the high rosmarinic acid mint, which was pretty cool. Now, the next one here, same study, we're looking at glycosaminoglycan. These are compounds in cartilage that help cartilage retain water. So really, really critical to cartilage function. And it's one of the things that's lost as cartilage becomes more osteoarthritic. So if you can retain more GAG, you can keep that nice bouncy function of the cartilage. And you can see same deal at day minus 21, we started feeding them. So the open circles are the horses that had the high rosmarinic acid mint. They had their challenge injection here at day 0. Control horses went up. Treatment horses did not. So super cool stuff. And then the last one here, just looking, this is a kind of a busy, chaotic slide, but just bear with me. On the top here, what you have is white blood cells of the control horses, which is the closed dots, and the high rosmarinic acid horses, which is the open dots. And you can see that the white blood cell count, an indicator of immunological stress, was higher in the control horses than it was in the treatment horses. Same deal down here with segmented neutrophils. So this is just giving an idea that you have a kind of a muted immunological response in these horses that had the high rosmarinic acid mint. I'm going to zoom along here a little bit because I feel like I'm getting a little bit too wordy. This one is spirulina. So this is a very new one. We just published this, I think, this year. Look at that. And so this was my PhD student, Nadia, who did a really excellent job looking at the effect of dietary spirulina in exercising horses. So in this particular study, we used exercise as an inflammatory stress. And one of the reasons why spirulina is interesting is that it is a very high source of DHA, which is one of the parent compounds for another compound called resolvin, which is involved in resolution of inflammation. And so what you're looking at here, this is the plasma resolvin, so resolvin in blood on day 0. The green bars, as you can imagine, these are the horses that receive spirulina, whereas the black are the controls. On day 0, they're basically the same. After 30 days, you can see that the spirulina horses had significantly higher resolvin, meaning that they're more primed for actually resolving any inflammatory event that happens. So this graph here is now looking at that same compound, resolvin, in synovial fluid. And you can see this is at day 0 is the top graph here, and the bottom is day 30. And you can see even in synovial fluid, we have a significant increase in the amount of resolvin that's available in synovial fluid. This really gives us a sense for the fact that we have an opportunity here to allow inflammation to happen, which has some benefits, certainly in exercise, but then rapidly and efficiently resolve that inflammation. And then the last one here, this is nitric oxide, and this is making that point that this is day 0. So again, no difference between groups. The bottom here is day 30. And you can see our nitric oxide response to the exercise stress was enhanced in horses that had the spirulina compared with the controls. So now I would be worried if at 120 days the nitric oxide was still high, but it wasn't. So what this is showing us is that we have a good inflammatory response followed by rapid resolution. All right, switching gears here to omega-3 oils. And this is another of my PhD students. This is Lindsay who did this work, and she's looking at an omega-3 oil and the ability of that oil to modify inflammatory responses. Now, a lot of the story is similar in omega-3 oils versus spirulina, because these omega-3 oils, again, are rich in DHA, which is a source, is a parent compound for resolvin. So what this is showing in this one, these are horses that had, the gray bars had this structure joint, which is an omega-3 supplement for 30 days, and the black bars were just the control horses. And you can see after 30 days, we had a slight but significant increase in nitric oxide. So this is very similar to what we saw in the spirulina research. And again, what you see here is these horses with the open circles, these are the ones that had this omega-3 oil already before. This is after 30 days of having that supplement. And then we did the exercise test. And even before we started that exercise test, you can see their resolvin levels were already significantly higher than the controls. So really kind of interesting data here to show that you can feed these types of products and not necessarily, and nor should you want to necessarily blunt the inflammatory response to exercise, but what you want to do is have it rapidly resolve. And these data provide some evidence for that. And then this is the last one I want to show you. This is the structured joint. Again, after day 0 is the black bars and day 30 is the gray bars. And you can see we had a significant reduction in joint circumference, i.e. swelling, after 30 days. So that's just a kind of a little snapshot of some of the research that's out there showing that there is some benefit. And I think if we follow that train of thought and we really start to, demand more research from the companies that are producing these products, I think we can really change the kind of the landscape of what some of these nutraceutical products are offering. Now, a couple of little final points here. I just want to look at a little bit about cost. So these are some of the 10, I asked ChatGPT to give me a table with the 10 kind of common nutraceutical products for horses, and then looking at cost per day. And you can see the cost per day here is widely variable. So on this particular, this is a NAF product here. This is about between 75 cents to $1.50 a day. These are all in Canadian dollars, by the way. Whereas this EquiThrive, you're looking at around $2. This Remard Total Joint Care, that's $5 a day. That's a Starbucks every morning. So that's pretty expensive. But again, this is top 5. So people are buying this stuff. So this is a snapshot of horses. This one here is a snapshot of the same idea with dogs. So you can see the dog products seem to be a little bit lower cost in terms of cost per day. I got to tell you, this surprised me. I thought because we're dealing with smaller amounts that the cost per day would actually be higher, but it's not. So interesting. Question is, does cheaper mean better? Well, sometimes, I guess. Cost is important, but it is also important to consider some of the things that companies can do to actually reduce the actual production cost, which may also impact the efficacy of the product. And one of the trends that seems to be kind of coming on board, maybe it's always been there, but is liquids. People love to like squirt stuff into the mouths. And partly it's because, for example, some dogs won't eat, some of these very volatile type compounds. Some horses won't eat anything. Some horses will eat everything, but some won't. So these liquids are really convenient because they allow you to put the product directly into the animal's mouth. But the problem is, depending on the type of extract that it is, you can leave a lot of the active active compounds in some of these herbs. They kind of get thrown out with the waste. It's a little bit like throwing the baby out with the bathwater. These are approximately 90% water, a lot of these liquids. So I did a quick look yesterday on PubMed and I put in the keywords herbal extract equine. I got 22 papers and 3 were in horses. Just to make the point, there's about 70 million citations in PubMed. So out of those 70 million, when you put these keywords in, you get 22 papers, 3 in horses. So we got a long way to go in terms of really understanding the benefit of liquid products in companion animals. And the other problem that we have is that, not all ingredients are equal. Like if a company buys a bag of, I don't know, echinacea on Tuesday, and they buy the same bag of echinacea from the same company 6 months later, is it the same echinacea? Are they going to have the same concentration of bioactives? So there's a lot of problems here. And most of the time, we're tripping over the fact that we don't have any evidence. We don't have a trail of evidence. So this is really a problem. And then final point here, what about safety? So this is a couple of things that I pulled out from the literature. This is a study looking at the effect of glucosamine supplementation in patients with type 2 diabetes. This is really relevant, I thought, because certainly in horses that have insulin resistance, there is this thought that glucosamine is potentially toxic because it gets transported into cells through the same GLUT4 transporter as glucose. So if you have that problem with glucose in these insulin resistant animals, is that problem augmented when you give glucosamine? So this particular study is actually looking at a clinical trial in humans with diabetes. And bottom line, they found no significant problem. So the main outcome measure here is hemoglobin A1C. This is a marker of essentially glucose metabolism. And you can see that this is the glucosamine group in the middle, and then on the far right, this is the placebo group. Basically no difference in the hemoglobin marker of glucose metabolism. So that suggests that glucosamine probably is safe, at least in humans with diabetes. Whether we can extend that to dogs and horses remains to be seen. The next one here is a case study that I stumbled across. This is a product called Dasaquin. It's made by a company called Nutramax. They make a lot of pretty successful products. This was a little, this poor little dog, I guess got a container of this. It was some kind of a, I don't know, Spitz cross or something, and ate 40 tablets. And the poor little dog started having seizures, all kinds of issues. The dog was okay, but it does make the point that it is possible to eat too much of this stuff to actually create problems. And it begs the question, well, where's the threshold, right? How safe is safe? After which point, when does it become toxic? That we don't know. And so I think even though this was just a case report, I think it really makes the point that we need to really dive into this stuff and get a sense for, how safe these products really are. Now, this last one, sorry, I know it's like really you're actually cross-eyed at this moment. You don't actually have to read all these. The reason I put it there is that this was a study that myself and my colleague Mike published this some years ago. And this was looking at the quality of evidence for glucosamine-based nutraceuticals in horses. And so what we found is that these studies that we looked at really didn't meet the criteria of good science. So even though there was research out there, how good was the research? How confident are we that we can actually believe what the data tell us? And certainly, I would argue that this picture, maybe it's changed a little bit over the last few years. To my knowledge, no one's done this again since we did it back in 2009. But the quality of science needs to be there. It's not enough to have research. You got to have good research, right? So then the other safety issue that, does bear commenting on is the fact that a lot of times we're giving these products to animals, horses and dogs and cats that are suffering. And if we're delaying more appropriate treatments because we think we're going to be giving products that are going to do some good and they don't, that is an indirect type of toxicity that we all need to really be aware of. Because some of these conditions that we're treating, and particularly arthritis, and again, ChatGPT did a great job of, I don't know, this leg's a bit weird, but anyway, it makes the point. And so we don't want to be delaying more appropriate treatments when we're relying on products that actually don't have a lot of evidence behind them. So a few take-home messages. Evidence on these products is limited and often indirect. So, most of these joint product claims, if they have research behind them at all, it's usually either low quality or not in the target species or not on the actual product. So it makes it really difficult for us to make really clear statements about efficacy. Second point, dose, formulation, and product quality matter. And how are we going to track that? Right? So an ingredient only works if it's present at an effective dose, it's bioavailable in the animal that we're feeding it to, and it is accurately formulated, which is often not the case. And the science, and not just the perception of science, should be what guide our decisions on product purchase. So we want to be choosing supplements based on critical evaluation of evidence and product-specific research, not just on marketing claims. So that's all I have for you. I thank you very much for your time, and I really welcome your questions. Thank you.
All right. Thank you, Dr. Pearson. That was a fascinating presentation. I want to thank you for that. Before we get started with the Q&A portion, though, we'd like to share a brief video, and then we'll be right back to answer the questions submitted during today's presentation. All right, as a reminder, you can still submit questions through the Q&A tab at the top of your screen. Dr. Pearson, the first question I've got some personal interest in. As I age, I'm more interested in joint health, and I do take some supplements. And so the question is, let me find it here real quick. Given that much of your research behind joint supplements is indirect and not species specific, how do you decide whether products is worth recommending for multiple species?
That's the million-dollar question, isn't it? For me personally, I think where the abundance of general evidence lies in terms of ingredients for joint health, my money's on the oil supplements. I think this is where I've seen the majority of benefit in terms of research benefit and consistency when you're looking at research across different species. Now, what happens when you actually include those oils with a bunch of other ingredients is anybody's guess. But certainly from a individual ingredient perspective, I personally I'm also of that ilk where I'm getting old and I need some joint support. And so I'm a believer in the omega oils for sure.
Okay. And we've got some questions related to that. One comes in from Han. He says, thank you for the nice presentation. For the omega-3 fatty acids, you focus mainly on DHA, whereas often EPA is indicated as more anti-inflammatory. Is the right conclusion here that you mainly focus on DHA when you target fast resolving of inflammation and EPA to prevent it? And then what dosage do you go for?
Okay, double-barrel question. I'll see what I can do. Okay, so first of all, EPA versus DHA. So the reason my pet fatty acid is DHA is because it is the parent compound to resolvin D1, which is the most abundant of the resolvin compounds. There are other inflammation resolving compounds as well. I'm not ignoring those, but certainly from the resolvin perspective, EPA is the parent to resolvin E1, which is produced in significantly less amounts. And we have data from our laboratory showing that cartilage, when you provoke it to produce inflammatory compounds and then pro-resolving compounds, it's the RED1 that's most prevalent. So now that doesn't say anything about activity, but certainly from a volume perspective, the DHA seems to be better from that perspective. Now, all that to say, EPA and DHA also have anti-inflammatory compounds, right? So that's different from inflammation resolving compounds. So, those are kind of two different things. Is the EPA better than DHA from an anti-inflammatory perspective? I haven't seen any evidence really that would compel me to that. I think from an anti-inflammatory perspective, they seem to be pretty similar. It's from the inflammation resolving perspective that my preference is for DHA.
All right, thank you. Lori would like to know, is glucosamine effective in prevention, not treatment of existing issues? So there's the question. Prevention versus treatment.
It depends on who you read. And some studies have suggested there is a benefit to prevention from a prevention perspective. Most of the studies that I've seen, either for prevention or treatment, are showing that glucosamine by itself is limited in terms of its activity. When it's combined with chondroitin, there are some studies that show that it is a benefit from a preventive perspective. But I got to tell you, the science is all over the place on this one. And I think a lot of it depends on the individual product.
Yeah, makes sense. Andrea is asking, considering the use of non-target species models in osteoarthritis research is often driven by the practical and ethical limitations of conducting studies directly in dogs, what strategies would you recommend to improve reliability and clinical relevance of these data when developing or evaluating products for canine osteoarthritis? Great question.
Yeah. And, there's a lot of barriers to doing research in target species when we're talking companion animals, but they're not insurmountable. I mean, I've built a career on developing minimally invasive models to evaluate these products in horses, and I have colleagues at the University of Guelph who are doing very similar things in dogs. So I think it's not so much about I think it's a lot about education and making people aware that there are resources available where these types of studies can be done. We do this literally every day at the University of Guelph. And there are other universities doing, similar research in little pockets around the world as well. But I think, some companies just don't know that resource actually exists. And so, like anything, I think education is really the driver for that question.
All right. Hans got another question. What is your opinion on the current trend of collagen hydrolysates and native collagen?
That's an interesting question because I've actually recently started kind of case testing that myself in me, because the research that I've seen is compelling enough to make me think that there's something there. I've never actually done research in the laboratory myself on collagen. That's actually entirely not true. We've got a project going on right now. One of my master's students is working on that. So stay tuned, because in 6 months, I'll probably have some actual data to show you. But in the meantime, I think the balance of evidence, at least what I've seen so far, suggests maybe a benefit.
All right, great. Next question is, do you see a benefit in combining ingredients like MSM, vitamin C, and collagen in equine, canine, and feline supplements to achieve better results? Collagen seems to be very popular in canine treats and supplements.
Short answer, yes. Longer answer, vitamin C, as I mentioned earlier, is a pretty important addition when you're feeding MSM, because it improves the absorption of MSM. But you do have to be careful, because some species, like horses, for example, they actually make vitamin C themselves from glucose. And when you feed vitamin C to them, it actually affects the enzyme that allows them to make it on their own. So once you start feeding vitamin C to a horse, you're kind of stuck with it unless you wean them off really slowly. So you do have to be a little bit careful with that. And I think there's a lot of benefit, a lot of potential benefit to adding these ingredients together. But I think what we need is science. We need somebody to put this product together and then test it. And that will give me what I need to say, yes, it's a great idea.
Yeah. Next question. I need to be careful here because I'm a marketer, but when companies say or market their products and say it's science-backed, what really should the layman be looking for to determine whether that claim is legitimate or not?
I'll tell you. If a company has spent the money on evaluating their product objectively, all you have to do is ask them. They will be more than happy to show you the research that they've done. If you ask the question about, hey, can I see your research? And they're like, well, here, and they show you some splashy infographic. That to me is a little bit of a red flag. No, I want to see the objective research, peer-reviewed publication. And again, if they have it, believe me, they will take your hand off to give it to you.
Yeah. All right. So we've gone past the top of the hour. Do you got time for a couple more questions?
Sure.
All right. Got one from Jordan. Is there a substantial evidence in the efficacy of hyaluronic acid and amino acid products? And have you researched these products?
I have not done research myself on exclusive hyaluronic acid in terms of like hyaluronic acid by itself. I have done research on products that contain hyaluronic acid. Those products have shown significant benefit in vitro, what that means is in cartilage models of inflammation. The reason why that's important is some hyaluronic acid is a really huge molecule. And so the bioavailability of hyaluronic acid is questionable. And we don't really know what that looks like in the various species that receive these products. So, theoretically, it should work as long as you can actually get it out of the gut and into the animal.
All right, very well. Well, I think we'll stop there. I want to thank you, Dr. Pearson, again. A fascinating presentation. And thank you, everybody, for attending today's webinar. If you have additional questions, please submit them to anh.marketing@balchem.com. And also visit balchem.com/real science for details on future webinars and to register for upcoming events. Balchem's podcast series continues to offer a deeper dive into our webinar topics. Log on to your favorite podcast platform and search for Real Science Exchange or balchem.com/podcast. And if you want a really cool Real Science Exchange t-shirt, just subscribe to the Real Science Exchange. Send us a screenshot along with your address to anh.marketing@balchem.com, and we'll get that off to you right away. And on behalf of Balchem and Dr. Wendy Pearson, thank you for joining us today.